So one more thing about the median nerve, we're going to take a look at it now in longitudinal orientation. And the thing to remember about this, again, is the appropriate anatomy. And in the area and slightly superficial to the median nerve, which is itself extremely superficial in the volar wrist, is this non-sliding tendon known as palmaris longus. So the palmaris longus passes superficial to the flexor retinaculum, whereas the median nerve is deep to it. But in longitudinal orientation, it gets a little tough to distinguish them. Something to remember about the palmaris longus is that this tendon highlighted in yellow, the palmaris, is absent in approximately 20% of the population. So once the probe is placed in longitudinal orientation on the volar wrist, remembering that the median nerve is deep to the palmaris, we need to use real-time imaging to distinguish them as being separate from one another. The thing about the palmaris longus tendon, as opposed to other tendons in the body, in this area, this is not a sliding or gliding tendon. When we activate it, it does not move, it doesn't slide, it just simply contracts. The function of the palmaris is to tension the skin in the palm of your hand, so when we flex our hand or make a fist, the skin on our hand doesn't roll up into a nice ball that makes it impossible to do that. So the palmaris just basically constricts the skin as we flex our fingers and our hand. So it does not slide, nor does it slide back and forth or have an excursion, I should say. So to distinguish palmaris longus from the median nerve and long axis, you'll notice that if the patient hand is slightly flexed, you can actually see palmaris, this linear band of tissue that kind of distends the skin. That's the palmaris there. You're going to place the probe longitudinally just to the radial side of this palmaris protrusion that we see here. And on the ultrasound image, this is long axis, this is proximal, this is distal, this is the radius, because we're looking at the median nerve here. This is the lunate, that's not the scaphoid. And there you see the flat, ribbon-like presentation of the median nerve as it goes down into the carpal tunnel.